Most people think rhinoplasty recovery is about pain. It is not. The hardest part is not knowing what is normal. I'm Dr. Yash Avashia, a board-certified plastic surgeon in Dallas, specializing in rhinoplasty and facial surgery, and I sit with patients every week who hit day 2 and think they've made a mistake. The swelling, the congestion, the unfamiliar face in the mirror, that moment of doubt is what nobody prepares you for. And if you watch this video all the way through, you'll know exactly what to expect at every stage, what mistakes to avoid, and when to trust the process versus when to actually pick up the phone. Let's talk about why recovery scares people. So most patients do a lot of research before their surgery. They research the surgery, they research their surgeon. Sometimes it's for a few weeks to a few months, sometimes it's for a few years. Once they decide on the surgery and their surgeon, they typically stop. And I think that's a big mistake. What they sometimes leave out is researching the actual recovery process. In my opinion, there's really 3 phases to the whole recovery process. There's the first that most of us know about. There's the physical recovery, the safety, the wound healing aspect of your surgery. But then there's the actual social downtime. And then the third phase is the actual long tail recovery refinement that happens. Everyone's got a different experience. For some people, that recovery is quicker, maybe a couple of months. For some patients, it's longer, especially for revision rhinoplasties, for example. It could be up to 1, maybe sometimes 2 years. And you have to understand that there are these 3 phases, and you have to let all those phases complete before you really see your final result. So let's go through the entire recovery timeline stage by stage. After surgery, at the end of your surgery, you're gonna have a couple things. You're gonna have stitches right here at the base, sometimes in the crease of your nose as well, if I had to narrow your base. And then every patient's gonna have splints on the inside and on the outside. Now, the splints on the inside is oftentimes a topic of concern with patients. They think they're not gonna be able to breathe. They think their nose is gonna be stuffed up and they have to breathe from their mouth for that first week. That's really not the case. These splints are silastic or plastic splints, and they have a breathing conduit. So as long as you keep your nose clean, you should be able to breathe through your nostrils as well. Now, every patient's gonna get very detailed instructions on how to take care of their nose. Use dilute hydrogen peroxide with water, clean your nostrils, remove any dried blood, any debris that may build up over the first couple of days, and also clean the incisions that you see. Everyone's gonna get a 2% mupirocin antibiotic ointment. After you clean your nostrils, apply that along the incisions and swirl the nostrils. So now once you've kind of understood that, what's gonna happen the first 3 days once you go home? A couple things happen for most of my patients, and for most patients who have a rhinoplasty. You're gonna see progressive swelling and congestion, and that's gonna happen over the first 3 days. You're gonna start to bruise starting on that day 2, going to day 3. And the bruising can be just kind of localized to your lower eyelids, and sometimes it can kind of curl into the medial eyelids and go a little bit above your eyelids as well. Some of this could be very scary for you, but realize this is normal. Feeling a pressure sensation in your nose, also very normal, because a lot of that's that internal swelling that's building up, and the splints are sort of maintaining that swelling for you. Sometimes patients say, I feel like my teeth are numb. Sometimes the up front teeth are a little numb after surgery. And a lot of patients come back saying, I can't really smile. I feel a little stiff when I smile. They can definitely smile, but it just feels a little stiff. Again, these are very normal in your recovery first week. And all this really gets better by the end of that first week. For pain control, I tell patients you should definitely take your narcotic medication. I provide hydrocodone for my patients. And sometimes patients need that for the first 1 to 2 days. Sometimes they need it for the first 5 days. Invariably, patients always say by day 5, my pain was much better. I didn't need the pain meds, and I was ready to just get my splints out. As far as the swelling is concerned, I tell patients there are a couple things you should do at home to really help reduce your swelling. First things first is ice around the clock. So every 2 hours for the first 1 to 2 days, ice your midface and your nose. Another easy trick you can do at home is drinking and eating cold things. So smoothies, ice cream, popsicles really help soothe and relieve some of the discomfort that you experience in that first couple of days after surgery. Once you get past the first 3 days and you get to day 5, pain's doing a lot better. You can transition to Tylenol if you still feel the discomfort. Now, once you get to that first week, day 7 or week 1 is a major milestone. It's the day you get all your stitches and your splints removed. Oftentimes, patients have a lot of emotions for this appointment. They feel anxious. Sometimes they're super excited. in anticipation for what they're going to see, sometimes they're scared. They make this major decision to change something on their face and they don't know what it's going to look like or how they're going to react to it. And so, believe it or not, the hard part is already done. This 1 week appointment is really about removing everything and getting to see your nose for the first time. Now, what's really important to realize is that what you see at week 1 is not your final result. Oftentimes, you're swollen. There may be some residual bruising, but in most cases, it's gone. But realistically, that is not your final result. And you have to really realize that at week 1, you get to see kind of the direction of where you're going. Now, for me, a lot of my patients are very pleased with what they see. They know exactly what it's going to look like. They've seen the changes, but they realize that they're going to be a little swollen. And that swelling gets better over the course of the next several months as you go on throughout the first year. At the end of your first week follow-up, when you have your splints taken out and your stitches taken out and you've seen your nose, I do something for all my patients. They get a skincare plan and they also get instructions on how to tape their nose. The skincare plan that we provide is going to include a couple things to help control swelling after their nose and to also help improve how their incisions heal. So everyone's going to get a scar gel. They're going to get a couple of skincare products to help manage their skin around their nose and their face. And then they're going to be taught how to tape their nose. Now, if you go online, you go on social media, you're going to see all sorts of taping techniques and routines. Some are super fancy, some are very basic. I like to keep it simple, something that every patient can do and something that actually works. And so we provide a taping technique. We provide the tape as well for patients to put on top of their nose. And this allows their soft tissue or their skin to heal down to their new framework, okay? And this helps with swelling as well. Now, how long do you need to do this? Not for months, only for 2 weeks. I tell my patients, do taping for the first 2 weeks, and then that's it. Taping doesn't change your result, in my opinion. The work was done during surgery, not after surgery. So tape for 2 weeks, and that's all you really need to do in those first 2 weeks after your splints are removed. After that first week, I think the next time point to really think about is from 1 week to 1 month. And during that first month, you see a lot of great things happen for you. You start seeing some of the early swelling subside. Most patients by 1 month for me come back at their 1 month follow-up and they say that they actually love the way they look. They know they've had rhinoplasty, but a lot of people that they associate with, their friends, their colleagues, they don't really realize they have had a rhinoplasty because the swelling has subsided so quickly. Believe it or not, you're still swollen and it's still going to get better and better every month throughout that first year. After that first month, typically I'll see my patients and I give them a clearance. You're cleared to work out. You're cleared to go back to your exercise routine. You're cleared to do a lot of the things around the house or at work that maybe you have sort of restricted yourself for that first month. And then finally, you're also cleared to swim. As long as all the incisions are healed, you can go back and swim in the pool. And so patients who get their surgery in the summer, at least here in Dallas, love to hear that because they can go back and jump in the pool. The next stage in your recovery timeline is really that 1 month to 3 months. That's our window of opportunity to really manage any swelling that might be a little more than the average. And so I see my patients back at 1 month, I see them back at 3 months. And if you're still swollen, what we're doing is we are doing a little special injection. It's a steroid combination to help reduce that swelling. There's really not a whole lot else you can do during the first 3 months. And now let's talk about that final stage in the recovery timeline for that first year. It's really the last 6 months, month 6 to month 12. That is when you really see a lot of the final swelling to subside. And it's a lot of that final refinement that makes the difference at the end of the day. So if you compared your nose from 1 week after surgery, 1 month, 3 months, and then let's say 12 months after surgery, they're gonna look different. And what you're gonna see is a lot of that definition really come in. You're gonna see the tip really settle into place, and you're gonna see the suppleness of your soft tissue around your nose really balance in with your face. And this is when you really start to see a lot of the beauty in a rhinoplasty. For most patients, they love the way their nose looks in that first 6 months, but once they get to 12 months, they really start to appreciate why they did the rhinoplasty and what the final result can really look like. I have so many patients that come back at 1 year and they say, I didn't think my nose was swollen early on, but when they come back at 12 months, they actually admit it was swollen and I can really start to see the difference. You really have to trust the process when it comes to swelling and the final result. Swelling can be asymmetric in the sense that sometimes the swelling is more on one side than another side. Sometimes they're doing more work on one side of the nose versus the other side to help balance that out. And that can cause swelling. And so realizing that there's going to be these minor changes throughout the first year really will help prevent panic and get you to kind of trust the process to get to the last month of your first year, essentially. All right, let's talk about the next phase in your recovery, the emotional downtime associated with changing your nose and your rhinoplasty. What people don't realize is that there is an emotional adjustment, a psychological adjustment that happens after you get your rhinoplasty. You've had a physical change to your face, but a lot of times there is a mental picture that we have of ourselves that hasn't really caught up with the physical change. And there's a time point. Sometimes to get the mental image and the physical image to come together, that could be maybe a month. For some people, it could take up to 3 months. For some people, it could take the full year. Once you get to that point of harmony between how you see yourself and what you think of yourself as, it tends to work really well and you kind of feel that harmony come in place. That's when you start to really experience the confidence improvement after a rhinoplasty. But believe it or not, it's different for everybody. And it's okay to feel a little unsure whether you made the right decision, or in some cases to feel super excited and to love your nose the moment you see it at 1 week. During this process of your psychological, emotional adjustment after a rhinoplasty, here's what not to do. Do not start going online and comparing your recovery to somebody else. Now, the great thing about social media is everybody's sharing their experience, everyone's sharing their journey. They're snapshots in your entire recovery, kind of pieced together into maybe a 15-second clip. That's not the reality. There's so much more that happens in between for that full year that's not really translated on social media or online. So the last thing you should do, in my opinion, is go online and start comparing your results to somebody else, comparing your recovery process to somebody else. Because at the end of the day, recovery is multifactorial. It's genetic, it's surgical, it's sometimes what you're eating, it's sometimes the temperature where you live. By comparing your recovery process to somebody else, it'll only build anxiety, and it actually takes away from what I think you really should be doing, is communicating with your surgeon. The recovery process is really that relationship between you and your surgeon or the surgical team that he has. And I think that's the difference here is, for me, it's not about just doing the surgery and being done. It's about walking that patient throughout that first year, handling their emotions or their concerns or their questions, and making sure they get to that end point, which is that first year after surgery. That's what's super important. If you're doing rhinoplasty, you have to have a relationship with your surgeon. And I think the biggest mistake you could do is kind of exclude them from that process in your life. So let's talk about the biggest mistakes and things to avoid during your recovery process. The first thing is judging your results too soon. Now, during a rhinoplasty, I like to take pictures on table for the before and after. And then we get photographs for the patients when they come into our office for all their follow-ups in our studio. These are standardized photos to kind of track their recovery process. And I will tell you from my experience, from the on-table results to that final 12-month result, it's very different. And if you take a photograph, or if you start looking at yourself and start to prematurely judge your results, I don't think that's the best thing for you. And you have to realize that it's actually going to change and improve over that first year. As I mentioned before, another thing you should definitely avoid during your recovery process is strenuous activities and exercising, especially in that first month. This is a very critical month of your recovery. Your nose is healing. And if you go back to your workout routine or your job that might be strenuous, you're going to see prolonged swelling. And the key with swelling is being proactive and tackling it as early as possible, like I said, in that first 3-month window after your surgery. But if you do a lot of these things at home or at work, and that's not ideal, it's going to prolong your swelling. And that will increase that timeline for your recovery. And then the final thing you should definitely avoid is not communicating with your surgeon or the surgeon's team and not showing up for your follow-up appointments. Follow-up appointments are put at a certain time point. For example, for me, it's 1 month, 3 months, 6 months, 9 months, and 12 months. And it's there for a reason. In most cases, your nose is healing, it's doing great, and I don't have to do too much. But I'm checking in with my patients. I'm seeing how they're doing emotionally. I'm seeing how they're doing psychologically. And I'm seeing that they're getting back to their normal routine in their life. They're going back to work, they're doing their activities, they're socializing. When patients are kind of restrained from doing a lot of the things that they did before surgery, to me, that's a cue to kind of check in and really see what's going on, see how they're feeling, and maybe help them a little bit along the way. These follow-up appointments are more than just a physical check-in. They're kind of a wellness check-in to make sure that you're doing well and you're recovering properly. A smooth recovery doesn't happen by luck. It happens when patients are educated, supported, and guided every step of the way. The nose you see at week 2 is not the same nose you see at month 12. If you're thinking about a rhinoplasty and want to understand what your recovery is going to look like based on your anatomy and goals, the first step for you is scheduling a consultation. During your consultation, we'll walk you through everything from before, during, and after. We'll include your recovery plan, everything you'll need to know before you step into the operating room. So if you're interested in a rhinoplasty, the link to book your consultation is below in the description.